Hey, Dr. Song here from Omni Aesthetics. Today I want to introduce you to a very special patient of mine. This patient, her name is Connie, is the first patient that I treated with regenerative stem cells from her own body. And this is not a cosmetic treatment. We actually treated her for severe arthritis in her knees. And since then, we've treated many patients with their own cells as well as cells from donated tissue for arthritic conditions as well as cosmetic issues. But I wanted you to hear for yourself what Connie has to say about the treatment she received 4 years ago. What was your life like before?
I couldn't walk.
Hold on. Okay.
I literally couldn't walk. It hurt to walk. I didn't want to do the laundry. I couldn't go up and down the stairs. If I did go up and down the stairs, I had to go sideways because any slight twisting movement caused my knee to get inflamed, and in some cases it would be inflamed for a week. And this was after a meniscus tear, after surgery, but I have the arthritis in the knee. I mean, as soon as I got out of the car, I was looking for the first, what do they call it, the grocery carts?
Support yourself.
I would need to lean on the grocery cart. When I first messed my knee up, my mother was still alive. And my mother had a walker. And there were days she was actually walking better than me. And that was almost embarrassing, or, whatever you want to call it.
How soon after the treatment did you start to see changes?
Immediately. Almost, in fact, I don't know if you remember when I handed you the log I kept for a month. From the day you gave me the stem cells, I never had to have my knee drained anymore. And me being so petrified of needles, I never had to have it drained again. And in fact, I have not taken Percocets. Rarely do I ever have to take an aspirin or a pain reliever, one of like an Advil or something. Once in a blue moon, if my husband and I just overdo it one day, then I might have to take, and that's just normal, that's body wear and tear. But I basically take no medication, no painkillers for my knee. I don't even put heat on it anymore. I used to ice it on a regular basis. I haven't been icing it. I would say that stopped about 6 months after you gave me the stem cells. My knee didn't swell anymore. And that was my biggest problem, was it would swell, and when it swelled, I couldn't move it. I couldn't bend it because it was so swollen. My knee stopped swelling. That was immediate, right after the stem cells. And I just noticed it got stronger. And one day I went to get out of my car where I would go out as I'm getting out, and I realized it doesn't hurt. My knee didn't hurt. When I twisted it a little bit, my knee didn't hurt. It's been, 3-4 years now since you gave me the stem cells in my knee. And I just want to let you know that I no longer limp. I have not had to have my knee drained since the day you gave me the first set of stem cells. I'm back to being able to do yards, to functioning, getting in and out of my car without any pain. I don't throw my knee out anymore. My legs over the past several years have gotten actually stronger. I'm able to do more and more. Right now, what I'm trying to focus on is getting my muscles stronger. But as far as with my knee, my right knee is 90% back to what it was before I ever injured it. And I just want to thank you for that. And now I can actually dance. I can dance again. I could do the Latin dances. I've actually done polkas. And I can't wait to have the stem cells again, because odds are I probably could use a little update, getting older. I'm 60 now. So, I'm going to have wear and tear on my legs, my knees.
So kind of as an early pioneer in doing this right now, what would you say if people were thinking about doing this? Would you recommend it?
Get it.
So
I am petrified of needles. And the one thing with the orthopedic is that all they had were these things that would last for 6 months. It was either that or full-blown surgery. I had the meniscus taken care of. But there was arthritic conditions because the meniscus was missed initially. And as a result, all I could think about or look to get are these 6 month, where they give it to you and 6 months later you got to get another needle. And I didn't want that. And I don't know what that stuff is going to do inside my body. And the thing is that like you said with the surgery, if you get your knee replaced, it only lasts so many years. I'm 60. Both my parents lived into their 90s, which means that I might be going for 2 sets of knees, if not maybe 3.
Yeah.
I want to wait as long as possible before I go for another set, and before I go for my first set of knees, let alone second and third. Okay, but I saw the damage. My mother not taking care of her knees. I saw that her legs were bowed out like this. I was waiting for her to snap one day. She had her first knee done at 85, and the second 86 and 87. And when she had it done, I had already hurt my knee initially from the initial fall. And I love to dance.
Well, I was going to say the other great thing about all this, because you kept mobile and functional and doing things, you didn't wind up with diabetes and hypertension and all the other comorbid factors. When people don't move, they can't function. They eat more, they exercise less, the things that they choose to do, their whole mental attitude changes. So, you've been able to do that as a secondary benefit and never really thinking about it. Look how enthusiastic you are. And as you said, it's 3 years. 3 years without having to go and have your knee drained, which can always get an infection. And now, of course, it's uncomfortable. Take medication like Percocet. We know, it's a narcotic, and we know what's happening in the world today with that. So all these factors came through because you had the chance to do something to help yourself and the ability, which is great.
No, it's...
All right. What can you do now? What are some of the things
You want me to do jumping jacks outside? I'm not kidding. I
show
can
us
do
the polka.
No, I'm serious. I can do the 1, 2, 3.
There you go.